Narcan training has begun in our office. Each deputy is going to be trained in Narcan by May 15th. Myself and Captain Mergenthaler were trained today by the Health Department. I want to thank the Health Department for offering that training here in Talbot County free for us. And we're working on securing the actual drug itself. So all of our deputies will be trained. Maryland State Police is currently trained in it, so we'll be the second agency in Talbot County that's carrying that, second law enforcement agency that's carrying that full-time in our patrol cars. Today, I met with all the chiefs, law enforcement chiefs, Easton, St. Michael's, Oxford, and Trapp. Mr. Patterson and his deputy from the State's Attorney's Office, Mr. LaCates, and we're going to meet quarterly, discuss common issues, and reinvigorate quarterly meetings to make sure that we're all cooperating, we're all on the same page, we're all heading in the same direction. But most of the meeting today was discussed on how we'll be supporting Maryland State Police and the Governor's initiative related to restoring peace in Baltimore over the next days and possibly weeks. I sent you all an email earlier today that described our response, which is going to be that the Maryland State Police is at skeleton crew shift levels on the Eastern Shore, and we have told Maryland State Police command staff that we can support them by providing extra deputies when they go below their minimum manpower to take over calls in the county to relieve them of that responsibility so they can attend to the needs involved. I want to just thank Brian LaCates for his efforts last night. Email came from our good friend Clay up the road about manpower issues and the needs in Baltimore, and Brian was on the phone. Me and him were on the phone juggling different things late last night, and I just wanted to take time to acknowledge that before I saw the email, he was on the phone to me saying, "Did you see the email?" And then helping me coordinate efforts last night, which was great. So basically last night we bolstered our manpower on the road to relieve the troopers of those duties, and today, as we speak now, the state police is at minimum coverage for each of the counties on the shore, and we're prepared and ready if they have to go below that minimum coverage to provide extra manpower. That's all I have. I just want to thank you for your service to this people of this great county. I'm honored to be your sheriff and to work along each of you and provide quality service to the families of the people of this great county. You guys have any questions?
Sure. Could you, the Narcan training, have you already worked up your own protocol for Narcan, or are you going to just use what MSP is using? How are you going to?
Yes, we have MSP's policy. We're going to tweak it a little bit to fit our needs, but we'll have that in place before we actually get the prescriptions filled. Well, the way Narcan works right now until the law gets changed is that each deputy will have a prescription that will get filled, and it'll be in that deputy's name. Like I'll have one in my name. But once we get them through that training, our policy will have caught up to it. And then we're trying to figure out now exactly where we go to get the best price on it.
Right.
I saw Councilwoman Price's email. I believe it was through Mr. Hollis about, I believe you were one of the MAKO things, and they were talking about the governor's initiatives up there. So we've been reaching out to all the people to have their ear to the ground in the health department to say, hey, there's got to be some grant money. I'm hopeful that there's some grant money coming out for this to help pay for it, because it's getting more and more expensive. It's up to $60 a dose now.
Wow.
And really, for us as the sheriff's office, my concern is, some of the things that we've raised before is that, all right, if we're in the Bay 100 or if we're out in the country away from our EMS stations where it might take a few minutes longer, although they have a great record of that, or if we have bad weather or storm or ice or snow, where we are in that position that we don't want to have to wait
No.
for EMS to come. So, you know, in the more centralized areas around Easton, it might not be as necessary, but my concern is being out in the country when there's some bad weather. So I think it really is an important thing that we...
What's the shelf life on the Narcan?
18 months is what we were told. 18 months to 2 years. And you have to be retrained every 2 years, but the training is very quick and easy, so that's not going to be a time factor.
But two quick things for me. I'm glad, number one, to hear that...
Yeah, we have had 3 incidents already where our deputies arrived at the scene before EMS arrived.
Oh, really?
That when EMS did arrive, they gave Narcan and the deputy realized that we had a kid, I say, at early 20s there on St. Michael's Road. The deputy got there. It was not a call for service. He just stumbled across the road, a car in a ditch, and it was a kid that was breathing 6 breaths per minute. We called, activated EMS. They came and provided Narcan. We would still do that protocol, call EMS, get them coming, but if this person is 6 breaths per minute, we could then give the Narcan. By the time EMS arrives, you know, they can handle it from there.
I'm not going to belabor, but the one thing I was saying to our former health officer, Ms. Paul, about Narcan is that it's fine to go ahead and administer the Narcan, but once a person is revived and he's up and moving around, there needs to be some follow-up with an individual through either the emergency room or through the health department or some other agency like Talbot Partnership perhaps, or through your agency, to kind of follow up on the individual to make sure if there's additional assistance he or she needs that is being provided.
Absolutely.
So when I've said this in some other different meetings I had both here in Dorchester County, that I'm okay with the Narcan, but in and of itself, just hitting the person and walking away, I think we need to also have some wraparound services and follow up with that individual as well.
No, I totally agree. I spoke with one of the addictions specialists, because I can't remember the exact title, at the health department. We talked about this very thing about getting those referrals to the health department and the addictions counselors being able to reach out. Now, we attended a couple of meetings with health department people, or at least I did, where we talked about that when people were brought into the hospital. How does the addictions folks make those connections? I know they have some of those connections through the hospital, but how do we make those connections? So I meet or talk. I don't meet with, but I talk with Charlie Rowe from the health department, who's one of the addictions counselors there, and we talk on a weekly basis about specific cases, about how we can better partner at the sheriff's office when people are looking for help, but 2, when we encounter people with help, which would be in this Narcan, and how do we get that information to them so they can respond to them with, hey, do you want treatment?
Right.
We can help you. So, believe me when I say my office has been, me specifically with the meetings with them, trying to bridge those gaps that you're talking about to have an impact. Because we know we're not going to have an impact. We're going to have an impact.
You're going to revive them.
We're going to have an impact. We're going to revive them, but we're not the person that's going to be able to help them get counseling and all that. We're going to point them in the right direction, give them the information, and get the person on the other end, basically give them the introduction to each other and say, hey, this is the marriage. Yeah, absolutely. Or we're just spinning our wheels.
With your lethality assessment form, you know, you go to a domestic violence, you got to do the form out, you got to make the call to the 800 number. If the person chooses to speak with the person on the other line, that's up to them. But it needs to be...
You make the introductions.
It has to be that. It has to be the mandatory second step that you do with the lethality assessment form that you do with the Narcan individual, a person that's been administered Narcan. So
right, and that's rare in law enforcement today. You know, I think we're gonna make some new roads in that, because that's the only way we're gonna have an impact on the community, the impact that we need by building those bridges.
And I'm glad to hear that. Again, that you accepted the position with the BRCOC. I think that your presence there will be very important as the BRCOC moves forward under Mr. Kapranica. And lastly, that you're having these quarterly meetings, and the State Attorney Scott Patterson, his office, has been involved in those meetings as part of law enforcement, because we have to remember that the State Attorney's office is a part of law enforcement. It's okay to go out and make the arrest and to hold them down to the detention center, But if you don't have that third piece, that prosecutorial piece to it, your arrest and doesn't really do any good. So you got to have that third arm of law enforcement, which is our prosecutor's office. I'm glad to hear that they're involved with you as that as well. And are you planning on attending the June 10th meeting down in Salisbury? Do you know yet?
Yes, I forgot to put that in my notes, but I actually met with one of the, I think it's up to 9, had a 3-hour meeting with one of the 9 people on the Governor's Heroin Task Force Initiative in Salisbury, Dr. Finnegan, who's on that board. I met with him for 3 hours last week to talk about the Talbot County perspective, some of the Eastern Shore perspective on it from a law enforcement standpoint. It went very well, but I will be at the June 10th public hearing.
You might want to get with you, maybe we can carpool.
Great, yeah, I'll haul you down.
All right.
I got room in the truck for your chair, too.
Yeah. Well, I won't have the chair on June 10th. No chair. I guarantee that. No chair. Anyone else from council?
Well, I was just going to ask a question about, the support services, how it's trickling up to Baltimore from the different counties in Maryland and certainly from some other states. And so when the governor declares a state of emergency, and when you think about weather events and things like that, there's funds that come from FEMA or other places to help pay for that. In a situation like this, how does that work? So if everybody's kind of moving up to cover other shifts. Some people are able to go into Baltimore. Maryland State Police is going into Baltimore. We're going to help cover their shifts, which is extra funding or expense for all of the different counties, and we're happy to do that. But does the state of emergency pay back at all to that, or is it just something that we all just do?
When in my other job with the state, for instance, Sandy or one of the tropical storms hit us, we do a full accounting on the other end of it. We did a full accounting, and I know with the sheriff's office, because we assisted Dorchester with evacuations during, I believe it was Sandy, with boats getting people out, and we got those from the sheriff's department, and Scott might be able to speak to it more than I can right now, but we will tally up our total costs, and I believe there will be a venue to at least submit those. I don't know about the reimbursement process. I don't know the ins and outs of it yet. It's just pretty new to me.
I mean, this is different. You expect it with the weather events and actual damage and things like that, but when you just need reinforcements for days or hopefully not weeks.
We'll get an answer on that.
Brian, do you know?
Can you speak to that? I mean, state of emergency, can we be reimbursed for certain expenses?
There is a good potential of that. So tracking of expenditures is always highly encouraged. It won't be until later down the road whether there's going to actually be funding available to backfill and reimburse local jurisdictions for additional manpower needs.
Okay. So there's an option to get that money back.
And one thing in that same regard, while we're talking about the issue in Baltimore, right before I came in here, I was contacted by a mutual friend of Lisa Spicknell and I. Remember Lisa?
Yeah.
She works for MAD now as an advocate for Mothers Against Drunk Driving. And I'm going to post later tonight on the Sheriff's Office Facebook. Lisa did a post last night where she said, hey, we're trying to support all the officers that are responding to Baltimore City with snacks and bottled water or Gatorade or whatnot, and gave a drop-off location. Well, her friend from Talbot County is doing a drop-off location at the Best Western Hotel on Route 50 here in Easton, where tomorrow and Thursday, members of this community can drop off cases of water, grab-and-go snacks that will be taken to the Southern District, where there are literally hundreds of different agencies, police agencies now in Baltimore City, where those will get out to the police officers that are out, working 24-hour shifts, whatnot. So it's one way that our community can support them. It's at the Best Western on Route 50. Just walk in the door. They're open 24/7. Just walk in the front door with your donation of a case of water or whatnot. And the sheriff's office here, the sheriff's office in Easton PD, and Sheriff Hoffman will be helping them on Friday to make sure that gets safely to where it needs to get in the city. So, hasn't been posted yet, but if you check that out on our Facebook page, I appreciate it.
And our friendly Star Democrat reporter is over there, so hopefully she can
I was
grab a little
briefing
headline in the paper.
Yeah, I was briefing her before the meeting on it. So.
Okay.
That's great. Anyone else for the sheriff? Sheriff, thanks again for the call.
Thank you.
Appreciate
Thank
all
you.
you men are doing.
Thank you.
Okay, Scott, good seeing you again, Captain.
Okay.